Well, the Ontario government has tabled the largest budget in the province's history. Finance Minister Peter Bethlenfalvy joins us now with more on the $200.2 billion spending plan. Good morning, Mr. Minister.
Good morning, Annette.
So there is lots of building in this budget, building highways, building hospitals. What about specifically with hospitals? What about funding for the people who work in those hospitals?
Yeah, absolutely. And, our healthcare workers, have done an incredible job. I think we all acknowledge that through the pandemic, but they continue to do an incredible job on the backlog in surgeries, the pediatric care, the acute care, the home and community care, the mental health and addictions care, long-term care. So that's why a big focus in this budget was putting in significant additional funding to support our health human resources. Things like putting another couple million dollars into the extern program, which is training nurses who are going through the education on site in the hospitals. It's like the More Money for the Learn and Stay program, where if you're in a community and you take your education there, we'll pay. If you stay in that community as a nurse or a healthcare worker and you stay in that community, we're paying your tuition, all your expenses. We're doing things like legislative changes so that as of right, if you're a nurse, personal support worker, doctor who comes in from another province to Ontario, you can start work right away. We're obviously working on foreign credentialing, bringing people who have those skills into the workforce and the health human resources workforce as quickly as possible. So it's not just a silver bullet of one thing, it's many things that you've got to do. We did increase the healthcare budget by over $15 billion over the next 3 years. Historic increase, not just for the hospitals, which is a 4% increase, not just for health human resources, but also more so they can hire home and community care resources, mental health and addiction resources, people who treat us in the community, treat us in the various settings at home or closer to where you are. So we're doing a lot of things in this budget to help people's health.
Now, what about retention for, say, the nurses that are there right now, that are working right now? Where are we at with the spending cap on their wages, their wage cap?
So I can't really go into much because, of course, we're appealing Bill 124. We've got negotiations with, well, not negotiations, it's arbitration with the nurses. Let me tell you this, we've been able to do deals with various employer groups without strikes over the last 4.5 years, primarily without disruptions. Everyone negotiates in good faith, and we got to represent the taxpayer, and at the same time, we got to support our workers. So, that's what governing is about. That's why we work with our workers. That's why we're up there with the private sector unions building Ontario. It's one thing to say you're going to build a hospital and staff it with personal support workers and doctors and nurses. We need the construction and the skilled trades to be able to build those hospitals in the first place. And let me just tell you this. We, in my region, Durham, in the Ajax Pickering Hospital, we built a long-term care facility right next door, 320 new long-term care beds. We got it built. They said it would take 8 years. We did it in 13 months, and that's fully staffed with personal support workers, with healthcare workers, and there's 320 more people that can benefit from long-term care, modern long-term care, than when we took over from the Liberals in 2018.
But we're hearing so much about burnout within the nursing, within nurses, within PSWs. I'm just wondering what this budget does for them. Seeing this, okay, that's great that it's fantastic. New hospitals, new long-term care centers are going. But if the people who are working in the current ones are still fighting for higher pay, what does this do for them?
Like I said, I can't go into discussions because with the nurses, we've gone into arbitration, so I can't comment on that. But let me tell you, we very much value all our healthcare workers right across the province, and we're not an island. Every jurisdiction has challenges recruiting, training, and retaining healthcare workers. What we've done is we've put forward a very ambitious plan, a funding plan that focuses on the continuum of care. So as our health minister said through her plan, access to care where you want it and where you need it, and thirdly, supporting health human resources. And so we're there with financial support And let me tell you, we have to invest in our healthcare, because without healthcare, we can't have a healthy economy. And our budget was very focused on building the infrastructure, the jobs, and the economy, so that we can grow this economy and be able to pay for our world-class system.
Okay. Finance Minister Peter Bethlenfalvy, thank you very much for taking time this morning to talk with us. I understand you have a news conference on senior care coming up a little bit later this morning, and we'll have more on that at chch.com.
Thank you, Annette.